Welcome. My name is Karen Hock. I'm a physical therapist at the James Cancer Hospital, and we're going to talk about rehabilitation and how that affects function and quality of life. I'm really happy to be talking to all of you. I wish we could see each other. This is our James Oncology Rehab team. This was after our last cancer rehabilitation conference in 2019. I am on the right in the first row on the end. So now you know who's talking to you. This is a fun conference we have. We host it with the University of Michigan, so we get to do a lot of joking around about OSU versus Michigan, but it's a great way for us to network with our colleagues and improve the education and learning for our oncology rehab team so that we can take better care of our patients. So today we're going to talk about the benefits of exercise in patients with cancer, but specifically in cancer that affects the gastric and esophageal areas of the body. We're going to explain what prehabilitation means and what that model of care looks like. We'll talk about ways to overcome barriers to exercise when you're dealing with cancer, and that's a big problem. And we're going to talk about what our oncology rehab team is doing. So first, let's start out with a true or false question. Cancer survivors exercise more following diagnosis compared to prior to diagnosis. If we stop and think about it, there's a lot of reasons why this would be true. It's a life-altering event, and sometimes that, makes us stop and take stock of what we've been doing. And so maybe some people do start exercising. But cancer also introduces a lot of other things into our life that may make that more difficult. So the answer is false. Less than 25% of cancer survivors actually are doing the physical activity that is suggested. And this is just when we want people to be active, because the benefit of exercise certainly outweighs not exercising. So we'll talk a lot about that. There's a lot of side effects of cancer and cancer treatment, and I certainly don't have to tell you that. I tried to make a list of some of the more common ones that truly affect how we move about and physically perform. Fatigue is an awfully large side effect of cancer and cancer treatment, and that can lead to deconditioning. There's obviously a lot of stress and anxiety. Changes in diet and eating can also affect how we physically perform. Anything that affects our sleep obviously will affect how we perform during the day. Cancer or cancer drugs can affect our sensation, so numbness in our hands and feet. That can affect our balance and how we move around, and also how we perform fine motor activities. Some of the cancer drugs can cause pain in our joints and our muscles to the point that patients don't want to move because it is so painful. And a lot of you have heard the term chemo brain and the fogginess that people experience. That can obviously affect our performance, but it can be positively affected by exercise. So what do we know about cancer and exercise? We know that exercise can positively impact many of these side effects and more. It can reduce pain and fatigue. It can improve balance, and we all need to work on balance. As we get older, that's one of the things that declines, and the risk of falls increases as we get older. It can reduce stress, and it can help us with joint stiffness and improve our strength, just to name a few. So let's talk about some exercise studies that involved patients with cancer. I always start with the McVicker-Winningham study. It was done a long time ago, but it was a pioneering study that's still cited today in the literature. These were two nurses here at Ohio State, we're very proud of that took a group of ladies undergoing chemotherapy for breast cancer treatment and put them on stationary bikes, and this had never been done before, and they showed that the exercise could reduce their nausea and vomiting, and also they showed that just them being together in a group was very helpful. So this is one of the first studies that showed the benefit of a support group, which wasn't actually their prime objective. So this is a very important study, and we always look to this study as we are doing research today. There's other studies that show that the better fit you are, the more physically fit you are, that it takes less from your immune system to be competent. So fewer immune cells are needed if they're good immune cells, and they're stronger because we exercise. The home study was another very impactful study, and this was, I can't believe it. It was back in 2005. It seems like it was not that long ago, but it was a prospective study. A lot of participants. Again, it was breast cancer, and as you know, that's a lot of times where these studies start because the number of breast cancer patients is so large. But it had some profound outcomes. They were measuring mortality risk and how it was linked to physical activity. And what they found was that 3 metabolic equivalents, and that's what MET stands for, is equivalent, 3 metabolic hours was impactful to reducing mortality. And that equates to a pretty average pace on a treadmill. If you're walking at 2 to 2.9 miles per hour on a treadmill, that is doable for most of us, or at least we can train to get to that point. So they found that for about an hour on the treadmill at a modest pace was impactful to reducing mortality from breast cancer. It was the first time we were ever able to say those words. And it's just taken off from there as far as the research has gone. So a few other studies, and again, we could probably talk about just fatigue or just balance for the entire time we've been given today. So we're going to try and hit a lot of these areas, but just not as in depth due to our time. So this study that was done in 2017 regarding fatigue looked at a lot of fatigue studies and a lot of references. They looked at pharmacologic interventions with medication. They looked at psychological interventions. They looked at everything. And exercise won out, which I was excited to see. Exercise was the best intervention to impact fatigue in a positive way. So that tells us that even though you're feeling tired and you don't feel like moving, getting you moving is one of the best things we can do. The psychological interventions were second. So a lot of studies now are looking at both modalities combined, which is a great way to balance some physical function and help with our mental health as well. The study done by Hardy in 2019 was also a pretty impactful study. Their primary objective was to look at the role of exercise in preventing the loss of muscle. And as many of you know, appetite is reduced. Dietary intake can really affect then how someone is nourished, and it can cause loss of muscle. And obviously, if we have loss of muscle mass, that will affect how we're able to move and our strength and endurance. So if we look at this diagram at the top, we see the things that a muscle wasting kind of environment can cause. We have more inflammation, which is something we don't really want. We have increased muscle weakness, increased muscle fatigue, reduced oxygen consumption when we exercise. And then it affects the density of our bones. But in the circle and in the green area, when we exercise, we can reverse those effects. We can reduce inflammation. we can reduce fatigue, and we can improve that oxygen consumption, and we can improve our bone density. So those are all important things. This study was a systematic review of systematic reviews, so they got pretty in-depth. And their conclusions are what we want to hang on here. Exercise is beneficial before, during, and after cancer treatment. So that's important, that we can make an impact before, during, and after treatment. Exercise is beneficial across all cancer types and for a variety of impairments. And we'll talk more specifically about GI cancer in a minute. And moderate to vigorous levels of exercise is best to improve function, reduce the side effects of cancer-related impairments, enhance our tolerance to cancer treatment. We want that too. We want you to be able to get the absolute best treatment that the doctors are recommending. And if we can help that by keeping someone strong and active, then we want to do that. And then it improves survival outcomes. And that's the evidence that we see more and more research coming out to support that. So hopefully I've made a case for why someone should exercise with a cancer diagnosis. We want to reduce fatigue. We want to improve the bone density. Again, improving bone density is important for all of us. As we get older and increase risk of falls, keeps climbing, we want to have strong bones. And that kind of goes hand in hand with improving our balance. The other thing we want to remember is most of us don't come into the cancer journey without perhaps some other health issues. You know, we may have diabetes or some heart disease, conditions that a lot of society has. So we have to consider that as we're thinking about rehabilitation. So we want to improve and maintain mobility with exercise. We talked about the fact that it can enhance your mental clarity or help with concentration. If it improves sleep, that usually will make most of us feel better during the day. It can improve appetite, and we could go on, which is why I left the blank there. There's so many other things that exercise can help with. So the big questions still remain, you know, how much exercise is good for me and what kind of exercise? This is an infographic that just came out at the end of 2019, and there's a lot of words on here, and I put the reference at the end of the slide deck so that you could find it on your own and perhaps see it better on your screen. But this shows how much exercise and what kind of exercise at this point in time in our research that we know can be helpful for a patient with cancer having different issues. So if we looked at the first line in cancer-related fatigue, aerobic exercise is impactful, as well as resistance exercise. And what we want to look at is overall, for most of us, 150 minutes per week of moderate exercise is good and impactful and can make a difference. So that's what you'll see in some of these categories. So this might be something you can pull up and spend a little time looking at, but we're going to talk about what moderate activity means. And just remember, 150 minutes in a week is pretty doable if you do, 30 minutes 5 times a week. And you can split up that time. You don't have to do your 30 minutes all at one time. We know that that can be beneficial for people as well. So 150 minutes of moderate activity. And as you know, moderate is different for everyone. What is moderate for me is not moderate for my 26-year-old son. So this guide, it's called the RPE scale, or rate of perceived exertion can help us a little bit determine what is moderate for each of us. So we want to exercise in, if you give it a number, in the 4 to 5 range, that darker green. And moderate activity should feel like I can do this for a while and I can talk to you while I'm doing this. I'm not so out of breath that I can't carry on a conversation. And it's not so difficult that, I think, oh, I can't even go one more second. So moderate should be something you can do fairly comfortably for an extended period of time. And 30 minutes right now on a treadmill for someone may seem like there's no way, but we can work our way up to that. Or if you've been fairly sedentary because of your treatment, just starting with short little bouts of walking can get you where you want to be in a reasonable amount of time. So let's shift a little bit more and specifically talk about some studies around exercise that have been done with patients with gastrointestinal cancer. So this study was done, I believe it was Ireland. You can see how some of the words in the title are spelled. It was a smaller study, and we find that with the GI cancers. Some of the studies are just smaller in number just because of the prevalence of the disease. But they looked at 21 patients. They were almost 2 years after surgery, and at that point they all had a suboptimal fitness level. So they did an intervention of 12 weeks, which is pretty good intervention, with some supervised exercise, and they did exercise at home. Aerobic warm-up, so important. They included resistance training, which was great. And then with any good exercise program, you want to have a cool down. And so they showed improved physical functioning and improved mental outlook. So good outcomes from that study. They listed some anecdotal comments in the article, and this was just one of them. A patient reported, they said the exercise would help, and it was hard to believe because you think it'll make you more tired, but it didn't. It actually worked, and the fatigue really lifted. I think the statements from patients who have gone through it are more powerful than anything your physical therapist can say, that the exercise, even though you feel like I am so tired I can't possibly do anything, but it really can make a difference. So this was another study. They looked at post-operative recovery after a minimally invasive gastrectomy. So again, not a large number of patients, but a good number, 24. They had a 3-phase exercise program, and that's going to be important. We're going to pay attention to this a little bit. So they exercised in the hospital after the surgery for a week. They went home and had some lighter, a little bit more than what they did in the hospital. So a little bit advanced exercise for a week. And then they took it up another notch for an additional 8 weeks. First, they found that it was very safe and feasible for this patient population to exercise. They had improved cardiopulmonary function, muscular strength, muscular endurance, and flexibility. So let's look at this graphic. You can see the in-hospital exercise. They did some bed exercises and some walking. Then for the home exercise piece, they continued with their bed exercises, but they added in standing exercise and continued walking. And then you can see that it got a little bit more progressed in that last 8-week segment. But what I want you to pay attention to is that big blank column before the in-hospital exercise. That's the piece we're going to talk a bit about. That's where the prehabilitation comes in. So let's move right to that. We say it's a new model of care, and I'm not sure how new it is anymore. I mean, it's been around now for several years, but I guess in the scheme of things, it still is pretty new. So what is prehabilitation? It's a preoperative or a pre-treatment program to optimize function and functional capacity with the goal of improving those post-surgical outcomes. So what can we do before you have surgery to make that surgical recovery even better? We're going to go back a minute. So what can we do in that big empty column so that as you move out of surgery, your recovery is better, and maybe we don't have as much regression as we would have if we didn't do anything. So a lot of prehabilitation programs might just be one thing. Maybe it's just exercise, but we're seeing now more multiple interventions before surgery. So exercise, maybe enhancing nutrition, looking at psychological interventions to decrease stress and anxiety, which is so important. And then for some patient populations, a program like smoking cessation might be important. So these prehab programs do look different for every disease group because there's different things that we need to be focusing on for different disease groups. For a breast cancer patient, we're very concerned about their shoulder function. For someone who's having a big abdominal surgery, we're very concerned about mobility and how's your aerobic endurance after a surgery like that. So why would we want to consider prehab for patients with GI cancers? Well, first, the surgical procedures, they're big procedures, but they've advanced, they're safer, and more people then are undergoing surgery for GI cancers. We know the age of onset for these cancers is a little bit later in life. So typically, we're not going to be in our 50s and 60s, perhaps without other medical conditions, arthritis, and that affects our mobility a lot, with some may have had joint replacements, like we mentioned earlier, diabetes or heart disease. And then we've learned from other cancer disease groups that addressing these issues early just leads to better outcomes overall. So we had a good model to follow. So there's several studies, we'll talk about a few, that were, these weren't specific GI cancers, but, abdominal type surgeries. So the first bullet is looking at a colorectal study. 40% of the patients received standard of care, and that did not include a prehabilitation intervention. And then the other group had received a prehab intervention. And we see that the group that had the prehabilitation far exceeded the group that did not. So 40% of patients receiving standard of care had returned to their preoperative walking capacity at 8 weeks, but 81% of the prehab group had returned to their preoperative walking capacity. So that's a pretty big difference. In the study done by Marker, he demonstrated that preoperative exercise during the neoadjuvant chemotherapy, which would be chemotherapy done before surgery, could be effective in maintaining and improving muscle mass and therefore physical fitness. So we talked about the importance of maintaining your muscle mass and how impactful that is to function. And so this study showed that by exercising before surgery, that made a positive impact. Another study, again, it was colorectal, reported that patients unable to walk 2 flights of stairs prior to surgery had an increased risk of postoperative complications. So that gives us a little idea of maybe what kind of functional ability could be something we'd aim for someone prior to their having surgery. Let's look at some prehab studies though, specifically with GI cancers. So this was a meta-analysis of prehab and GI cancer patients. The exercise intervention was moderate aerobic and resistance training, and we talked about what moderate is. Most of us can do that. They looked at improvement in a 6-minute walk test, and a 6-minute walk test is exactly what it sounds like. You walk as much as you can in 6 minutes, and it's a very commonly used outcome tool, and it's valid and reliable. So it's easy to perform. So they looked at the improvement in a 6-minute walk test prior to and following surgery compared to a group that did not have the exercise intervention. And they did better. Now, there was no change in some of the things that we'd like to see, like postoperative complications, surgical site infections, length of stay. And maybe with more research and better studies, we'll see that also. Now, the one thing that this meta-analysis struggled with were the groups were they were different between studies. So it's hard to compare one study to another when the groups are very different as far as cancer stages and maybe the other comorbidities they brought with them. So we know more research is needed. If I ever read a research paper that said we were done studying something, I don't know what I do. We just don't ever see that. So we know more research is needed, but we know that we're seeing in these studies that they're doing the positive impact of exercise. This was a preoperative exercise, again, for GI cancer patients, a systematic review, which is what we like because it had a lot more patients in it. So 9 studies, but 534 patients. That's quite a bit. All interventions included aerobic training, but again, this is where we get into the differences between studies. They had a varied duration, intensity, and frequency, but still, pre-op exercise was associated with a more rapid recovery to baseline function after surgery. If that were the only benefit we saw from exercise, that would still be worth doing the exercise prior to surgical intervention. But we know there's other benefits like we talked about. Here's the issue. There's barriers to exercise. We have barriers to exercise without cancer. I can come up with a million reasons why I don't have time to exercise. None of them valid, but I can make a case for why I shouldn't be exercising because I have other things to do. But in the case of a cancer diagnosis, that can get even more complicated. And the reasons that people don't have time to exercise are probably even more valid. The one thing that we always run into is that short time between when someone is diagnosed and when surgery may happen. Sometimes that happens so quickly that a prehabilitation plan may not be able to be put into place. This is a time of a lot of stress and anxiety, and asking someone to do one more thing just sometimes is just too much to ask. And then kind of along the same lines, it's difficult to prioritize exercise when you have a multitude of doctor's appointments or scans that they want to have done before surgery, plus your regular family responsibilities. And you may be tired and you're not feeling well. So this is where we have to study some more and really figure out what is the absolute best exercise, the most efficient way to get these results, and given all of the other variables that we need to deal with. So this is where further research needs to be done. We need to be more effective and more efficient in our exercise interventions. So we'll talk a little bit about our department. We are a group of physical and occupational therapists. We specialize in the treatment of patients with cancer through rehabilitation. We have 3 different clinics, soon to be 4. We have a clinic in the Spielman Breast Center. We have an area within the Cancer Supportive Care Services, which is in the Morehouse Tower on the 6th floor. And we're on the ambulatory floor in the main James Tower. and that's on the 5th floor. And soon this summer, we'll have a clinic in our new Grove City location. So one thing we have discovered is the closer we can be to where patients are seeing their physician, the more efficient and effective we can be in our interventions. It reduces some of the geographic traveling patients have to do, and maybe it reduces some of the scheduling issues that can come from trying to do just another appointment. So our goal is to be as accessible to patients where they're seeing their physicians as we can. I listed our main number there. That's the best way to get a hold of us. We have several programs that really cross all cancer diagnoses. And one of the main ones, and the one I might like the best, is our James exercise program. It's an individualized exercise plan, and it's based on where that person's needs are, because everybody's needs are different based on a diagnosis, comorbidity, the treatments or surgeries they've had. So for this program, we might see a patient once a week for 4 weeks to teach them the exercise program that is best for them. It can be modified to any level of activity if you're someone who's been fairly sedentary because of your treatment, or if you're a very active person and are trying to get back into that exercise again. And it can be modified based on where you want to exercise. You know, if you're going to be a home exerciser versus a gym exerciser. And hopefully someday the gyms will be back open again. But this program can be very much tailored to each individual person. So we've had a lot of success with that. We have prehab programs for a lot of different cancer groups: breast, bone marrow transplant, the sarcoma patients. We've been doing some with the HIPEC procedures, but just because, you know, if you're not listed in this group doesn't mean that a prehab program isn't appropriate. So we'd like to expand that more in the GI, with the GI services. Our department has been getting more and more active in clinical research. We've had a study done for chemotherapy-induced peripheral neuropathy. That's a numbness, tingling that people can get in their hands and feet after many of the chemotherapy drugs. We tried the clinical intervention and taught it to patients for home use, and we found that it was very feasible to be done at home. Patients experienced less pain and an improved quality of life. So we were very pleased with the results of that study. We're doing a couple studies right now looking at shoulder mobility in patients going through radiation for breast cancer. And our exercise and radiation study is exercising patients during their radiation course. And that study right now is on a hiatus, but will pick up soon, and has been a very positive study. Actually, right now there's another study going on regarding peripheral neuropathy, looking at how quickly is that onset once you start chemotherapy. So the Epiphany study just started maybe the end of last year. And then hopefully there's a study pending looking at prehab for pancreatic, liver, or gastric cancer with gastric cancer surgery. So awaiting hopefully some funding for that, which would be very exciting. I listed all the references that I used for the talk. So there's quite a few here. At the end of this list, I have the link there for that infographic with all the exercise information listed. So hopefully, it's awfully long, but maybe you can copy and paste that right into your browser. This is my information. I'd be happy to talk to you or answer any questions that you may have. Hopefully you found the information today to be beneficial, but I'd be happy to answer any questions or talk to you in more depth about anything that you might want to discuss. This is the first time I've done this kind of presentation, so it feels a little different not to be able to see you, but I certainly wish you all the best and many blessings and good health moving forward. And please feel free to reach out at any time. Thank you.